And go.
And action. Okay, knock knock. Hey, good morning, Miss Smith. My name's Shelley. I'm going to be your nurse today. I'm going to put a catheter in you into your bladder. Did your doctor talk with you about that? Do you have any questions? Can you tell me your name and date of birth? Okay. Remove this. Are you allergic to betadine? You're not? Okay. I'll get my equipment. I'm going to have to lay you flat for a little bit, so is that going to be a problem? No. Okay, before we get started, I would do pericare to be sure that she's good and clean, and I would check with my pen light or a light to be sure that I could see her urinary meatus and to see if I need help with her. But I won't need help with her, so I'm going to continue on my own. So after done pericare, I'm going to wash my hands again and go to bed. I'm going to pick her up to where she's more at my height. That's the wrong button. Let's pick it up. And I'm going to have to expose you in a little bit, so I'm going to cover you up with a sheet for your privacy. I'm just going to fold my bed linens down to the bottom of the bed so I don't have to remake my bed later. And I'm going to go ahead and lay you flat. Pick your legs up and separate your knees as far as I can, because I'm going to want a good working area here. On a catheter, you can keep your supplies over to the bedside table if you need to, but for today and for checkoffs, we're going to put them here. And I'm just going to keep you covered for right now. Open my bag. Let's set it out. And I'm going to take me a garbage bag here on my bedside table. That will keep me from dropping my hands below my waist with putting stuff in the garbage can. So I'm going to tape it really well to my bedside table, because you don't want it to come loose. And you want to be sure that this is good and open for you. And I'm going to set my kit down on the bed. I'm going to go ahead and expose her. I'm going to go ahead and expose you. When you open the kit, remember, you have to open away from you. So this tab has got to go away from you. Well, so the first one, second one, third one, and finally the fourth one. And I'm a little particular, so I always square mine up. I'm going to touch just there to that edge. Now in my kit, the next piece that's there is the underpad, and I want to be sure that I'm just touching the edge. So my hands are not gloved, so I'm going to have to be sure that I do not touch the inside. So I'm going to kind of fold it up. I'm not going to drag it. I'm going to put it under her hips. Just touch the edge I'm going to ask her to pick her bottom up if she can. There we go. Now I'm going to take my gloves over here. And I'm not turning my back on my sterile field. I'm just kind of to the angle of it. I'm going to put my gloves on. Okay, now that my gloves are on, I can touch anything in my sterile field. I'm going to move this up here closer. I'm going to set this back here. I'm going to pick this up. This does not have a shiny side or a non-shiny side, so it won't really matter. And I'm going to lay it down. And this is sort of an X marks the spot. If it happens to fall, you want to try not to touch it because you've still got both hands sterile. I'm going to open up my betadine swabs because I've asked her if she is not allergic, and she is not. So I'm going to divide my cotton balls up, and I'm going to pretend to put some betadine on this. We don't want to open the betadine for real. Then with my hand up high, I'm going to drop that into my garbage. I'm going to open my lube, and I'm going to put just a little bit on my tray for practice. And you can throw this away, but it's still sterile, so I'm going to set it there. I'm going to take the top off of my for my sterile water that's going to fill my balloon. Now both my hands are still sterile, and I'm going to take the covering off of my Foley catheter and lay it back in there, being sure it doesn't flip out. Then I can just lay it up there. Now I'm going to connect my syringe to the bulb inflation port there, okay? And I want to lay it so it doesn't pop out, because if this flings out, you could easily contaminate it if it was to hit the leg or flop out. So I always want to be sure that I've got it to where it's not going to fling out and get contaminated. Okay, so I'm for sure I've got everything set up before I contaminate my non-dominant hand. Okay, I'm fixing to touch you now. I always tell the patient I'm going to touch them, because if you touch them, they may jump and get startled and just destroy your sterile field. So I'm going to touch you, and you're going to separate the labia. With your sterile hand, you're going to get a cotton swab with a betadine. Clean the far side first, from front to back, with one swoop. Come around your sterile field, drop it in the garbage. Get another one, the closest side, front to back. Come around your sterile field, drop it in the garbage without touching the garbage bag. The last one, go straight down the middle. Come around. You want to be sure if you're cleaning, you've got to keep the labia separated. If I closed it back, then I have to clean all over again. So I'm going to keep it open. And you can put these in the garbage if you like, but they're still sterile, so I'm going to set mine there. I've got my catheter. I'm going to put some lube on it. On the count of 3. 1, 2, 3. You want to be sure you don't hit anything but the meatus. And you're going to insert. Your hands cannot touch this sterile hand cannot touch the patient's skin. You're going to insert it, usually about 3 inches, until you see urine come out into your tube. Once you see urine, you're going to advance it another inch. And then with your non-dominant hand, you let go there, and you're going to blow up your balloon. Then you can let go and do that. Then you have to pull back on it to set that balloon back down into the neck of the bladder. So you pull it a little bit. And then you're going to tape this to the inner thigh on a female, you would tape it up here with some tape. On a man, you would tape it here or up to their abdomen. But this one here has got a nice little stat lock on it. And you want to give them, you don't want to pull it tight because that could cause it to pull out. So you got to give them some slack. But this one has got a stat lock on it, and these are really nice, so we will use it. And that just lays in there like that, clips in, and then that will move as the patients move, and you have a greater risk of it not pulling out. If you look here on your catheter, you can also see what size it is. It's a 14 French with a 10 ml balloon. And that will come in handy when we have to take it out. So after you finish putting your catheter in, of course, you're going to clean up your mess. You're going to do pericare because you want to get that betadine off of the patient's skin. You're going to put her clothes back. You're going to put her in a comfortable position, bed in lowest position, call out and reach, side rails up, and you're going to document how much urine came out initially, because it should be, maybe it's, you want to document the size of your catheter, how much initial return you got, the color of it, the clarity of it. Is it yellow and clear? Is it amber and cloudy? And how much? When you do put the catheter in, and your catheter kit also comes with a urine specimen kit that you can do for the first time, and I'll explain that in class. If you happen to put your catheter in and there's more than 1,000 cc's that comes out when you first put it in, you have to clamp it. You only want to remove 1,000 cc's at one time because it can cause the patient to have bladder spasms. And then you wait about 15 minutes and you can open up and drain the rest out. So we'd hang this to a non-movable part of the bed, so when the patient moves the bed up and down, it won't actually pull the catheter out. Now to take out the catheter, because in your checkoff you'll have to take out the catheter, you would come in and do your A-wipes. You would tell your patient that you've got an order to take the catheter out. You always want to check your order. You come in, you empty the urine out of the bag and measure it. You want to be sure that you do pericare. Tell your patient what you're going to do. You have to know how much fluid is in this balloon. So it says there's 10 in it, so I would bring a clean 10 ml balloon with me, and I should draw out 10. Sometimes I empty a little bit of this out and check it again to be sure a nurse hasn't put more than what it says in it. So I've emptied out my 10. I'm going to tell the patient to take a breath and breathe, and I'm just going to pull it out. And I'm going to wad this up and throw it away. Of course, I've already emptied my urine out of it. I'm going to do pericare, and then I'm going to document that I removed the catheter, how they tolerated it, that my catheter was intact, because you want to be sure some of this has not been left in the bladder. And then I'm going to still, even though the catheter is out, I'm going to want to monitor their I&O for 24 hours to be sure that they are able to empty their bladder. And I'm going to want to be sure that they void within 8 hours, because it's very common to have to put a catheter back in someone. So they should void within the next 8 hours. And then I would leave them back, same position, or lower the bed, side rails up, comfortable position, call out and reach.